Um, Good afternoon, everybody. My name is Dr. Ndaisa Okone, and today I'm going to discuss the endocrine disorders um, and breast disorders. At first, we need to understand that the endocrine surgery is the subspecialty within general surgery with the key principles. Here is multidisciplinary care. Here, the preoperative optimization is the key. This one and the and the perioperative, you need to protect the nearby structures such as vessels, glands, and other organs. Here we are going to focus on getting knowledge on the surgical management of the disorder of the thyroid, parathyroid, and breast. Then on thyroid gland, the thyroid disorders, we are having there is a goiter, which is maternal refused or toxic. There is compressive symptoms such as dysphagia, dyspnea, strain, then on thyroid nodule, there is disc of stratifications, and they said there's the cytology on final aspirations, suspicious of malignancy. Then on thyroid cancer, the one which is most common is papillary, but has a good prognosis. Others they are follicular, nodular, anaplastic, which is more aggressive. Then have hyperthyroidism, where the condition which are in that category is you have grave disease, toxic nodule, multinodular goiter. This one when resorted to medication therapy or when with the large goiter. You get the indication for thyroidectomy. We have in cases malignant, here you can do total or near total thyroidectomy plus minor central or lateral neck dissection. Then symptom or large goiter causing the compression, that's the key. Have hyperthyroidism and is not controlled medically. Suspicious nodule or proven cancer. Then the type of surgery, I have thyroidectomy, total thyroidectomy. Those are the three major type of surgery. Then the key point in preoperative, we are having preoperative where we have optimize hyperthyroidism to avoid the thyroid storm. Vocal cord check, checking the calcium stroke, vitamin D status. Intraoperative, then you need to identify and preserve the recurrent laryngeal nerve and superior laryngeal nerve. Then on parathyroid, parathyroidism identifications. Then on post-operative, we need to monitor for hematoma, hypercalcemia, recurrent laryngeal nerve injury, Then the complication between it, there is bleeding, hematoma, there is the current region of injury, there is hypoparathyroidism, hypocalcemia, of the infection scars, and esophageal injury. Then on parathyroid disorders in surgery, here we have primary hyperthyroidism, which are most common. There is single adenoma, which counting 85%, hyperplasia, and here carcinoma. The classic, we have a stone, bone, psychiatric pain, psychiatric overtone, bone pain, abdominal pain, fatigue, often asymptomatic. Diagnosis, there is high calcium level plus inappropriate, normal or high parathyroid hormone, and localized with ultrasound plus 4D scan. The indication for parathyroidectomy will have symptomatic disease, asymptomatic with specific criteria, and have many syndrome. Then procedures here will focus minimally: invasive parathyroidectomy, localized adenoma, bilateral neck exploitation for hyperplasia or negative localization. Then the complication we are having hypocalcemia, recurrent region of injury, and persisting or recurrent hyperthyroidism. Have adrenal disorder, need adrenalectomy. The common surgical indication, the functional tumors, like phaseochromocytoma, have Cushing's syndromes, have Cohen syndromes, all those on their functional tumors. Non-functional tumors have incendiaroma, which is above 4 to 6 centimeters, or with suspicious features like risk of malignant adrenocarcinoma or metastasis. Perioperative preparations, like the 5 chromocytoma, we need to give alpha blockade in the first place. Then beta blockers, volume expansion, avoid unopposed beta blocker. Then Cushing's, you cover with steroid postoperatively. You also need to do imaging such as CT or MRI for localization, or functional scan if needed. Surgical approach, there is laparoscopy, adrenalectomy, which is a gold standard, less pain and shorter stay. The second house also, we have open adrenalectomy for large tumor. Then comprehensive bleeding, the infections, organ injury, adrenal insufficiency, hemodynamic instabilities, especially in chromocytoma. Then on breast disorders, we are going to focus on the following. They are the benign and the non-malignant. In benign, we have fibroadenoma, which is most common in young, less than 30 years. Have breast cyst, have fibrocystic chain, ductus, intraductal papilloma, gynecomastia in male. Then with the management, here we excise and drain the abscess, but also most of those benign, I'll do observation Yeah. This image is showing us the doing excision and drainage of the abscess in benign. Then on malignant, we have the invasive ductal carcinoma, which is most common, and invasive lobular carcinoma, ductal carcinoma, in situ. Special type, we have the inflammatory breast cancer, which show at podolange, lymphoma, Paget disease of nipple. That is assessment, which will have three components: physical examination and imaging plus biopsy of the breast. This option have breast conserving surgery or lumpectomy, have mastectomy, have extra staging, have oncoplastic technique on the for better cosmetics. Then indication for surgery, confirmed malignant or high risk lesion, symptomatic benign or diagnosis is mastectomy. Key complications: seroma, lymphedema, sensory change, cosmetic dissatisfactions. On perioperative note, we are having neoadjuvant chemotherapy for downstaging, post-op, drain care, immobilization, physiotherapy. Give also trastuzumab for HL2 plus Paget disease, which is high. The high characteristics have eczematas, scars, or ulcerated nipple, homocystosing with underlying ductal carcinoma in situ. Diagnosis is confirmed by nipple biopsy showing the Paget cells. And other endocrine surgical topics need to be cut: neuroendocrine tumors, pancreatic gastrodioma, preoperative endocrine such as the diabetes. We need to optimize glycemic control, steroid cover for stress dose, steroids for patients with chronic steroids such as lymphedema crisis, multiple endocrine neoplasia. Practical skills, those one which are listed that side. We need to do neck mass such as those one, thyroid goiters and nodule, complete thyroid function test. Thank you for listening. Don't forget to subscribe, like, share. Thank you.